Acne is one of the most common skin conditions in teenagers, affecting up to 85% of adolescents at some point. In today's video, I'm going to go over a 7-step treatment plan for acne in teenagers, starting with mild treatments and then going stepwise to stronger treatments. At the end of the video, I will also go over some of the biggest mistakes people make when trying to effectively treat their acne. Hi, I'm Dr. Morgana Colombo. I'm a board-certified dermatologist and founder of Vida Derma, a science-based skincare line to help women as they age. Acne develops when hair follicles become clogged with oil, dead skin cells, and bacteria. During puberty, rising hormone levels, especially androgens, cause the skin's oil glands to become more active. This excess oil combined with sticky skin cells creates the perfect environment for clogged pores, blackheads, whiteheads, and inflamed pimples. Acne is not caused by poor hygiene. Scrubbing harder will not make it go away. So remember that, don't scrub harder. In fact, harsh washing can worsen irritation and lead to more breakouts. The key to treating acne is understanding that it is a medical condition with multiple causes, and effective treatment targets each of those causes in a structured, step-by-step way. Now, before we get into this stepwise treatment, remember that each teenager is unique. For some patients, we may skip around and offer some treatments earlier than others, but this is generally how we think about acne treatment when it comes to the least potent options to the strongest therapies. For acne in teens, you want to start with gentle skincare, and over-the-counter treatments is often enough for mild acne. The first step in acne treatment is building a simple, consistent skincare routine. Teens should use a gentle, non-abrasive cleanser twice daily. You want to avoid harsh scrubs because those can damage the skin barrier and worsen inflammation. One of the most effective over-the-counter treatments is benzoyl peroxide, typically in concentrations of 2.5 to 5%. This ingredient works by killing acne-causing bacteria and helping to unclog pores. It is widely recommended as a first-line treatment by dermatology guidelines. However, benzoyl peroxide can cause dryness, irritation, and bleaching to fabrics. Starting with a lower strength and using it every other day can help the skin adjust and diminish irritation. Moisturizing is also important, even for acne-prone skin. You want to use a non-comedogenic moisturizer that helps maintain the skin barrier and reduces irritation from treatments. Adding a topical retinoid can prevent clogged pores and improve long-term results. Topical retinoids are one of the most important treatments for acne and can sometimes go hand in hand with step 1. So adapalene 0.1%, now available over the counter, is often a really good starting option for teens. Retinoids work by increasing skin cell turnover, which prevents pores from becoming clogged in the first place. This makes them especially effective for blackheads and whiteheads, but they also help reduce inflammation over time. Retinoids are typically applied once daily at night. It is important to set expectations when using retinoids. During the first few weeks, acne could actually look worse before it actually gets better. So the skin sort of purges in the beginning. This is called retinization and is actually a normal part of the process. Dryness and peeling are also common early side effects, but they usually improve with continued use and proper moisturizing. Retinoids are not just a treatment, they're also one of the best maintenance therapies to keep acne from coming back. Combination therapy is often needed when acne does not respond to basic treatments. If acne does not improve with over-the-counter products after about, I would say, 6 to 12 weeks, prescription treatments may be necessary. When steps 1 and 2 are still not enough, dermatologists often move on to topical combination therapy, which uses multiple medications that target different causes of acne. Examples include products that combine a retinoid with benzoyl peroxide or a topical antibiotic. These combinations are way more effective than using a single medication alone and are easier to use, which improves compliance. Topical antibiotics such as clindamycin should never be used alone because this can lead to bacterial resistance. They're always paired with benzoyl peroxide to reduce the risk of bacterial resistance. This step is important because treating acne early and effectively can prevent long-term complications such as scarring and hyperpigmentation. Step 4 is to consider azelaic acid. Azelaic acid offers a gentler alternative for sensitive skin or discoloration. For teens who cannot tolerate retinoids or benzoyl peroxide, azelaic acid is a valuable option. It has antibacterial and anti-inflammatory properties, making it effective for mild to moderate acne. One of the biggest advantages is that it also helps reduce post-inflammatory hyperpigmentation, which is the dark spots that can remain after acne heals. This makes it especially useful for teens with darker skin tones who are more prone to post-inflammatory hyperpigmentation changes once their acne heals. Azelaic acid is generally well tolerated with fewer side effects than stronger treatments, although mild irritation can still occur. Step 5 is moving on to oral medications. Oral antibiotics may be necessary for moderate to severe inflammatory acne. When acne becomes more widespread or inflamed, such as red painful bumps on face, chest, back, oral antibiotics may be added to the treatment plan. Medications such as doxycycline or minocycline work by reducing bacteria and inflammation. They can lead to noticeable improvement within 1 to 2 months. However, these medications are not meant for long term. Most guidelines recommend limiting treatments to maybe 3 to 4 months max to reduce risk of antibiotic resistance. They should always be used alongside topical retinoids and benzoyl peroxide. Long-term wise, you want to maintain people with topicals, not oral antibiotics. Common side effects include sun sensitivity, stomach upset, and rarely irritation of the esophagus if the medication is not taken with enough water. Teens taking these medications should be advised to use sunscreen daily and take pills with a full glass of water. I particularly tell them to take it with breakfast with a full glass of water. Another potential option is using medications that affect the hormones. Hormonal treatments can be highly effective for female teens with persistent acne. In female teens, acne is often influenced by hormonal fluctuations. This is especially true when breakouts worsen around the menstrual cycle or do not respond to standard treatments. Combined oral contraceptive pills are FDA approved for acne and can significantly reduce inflammatory lesions. Studies showed they can reduce acne lesions by over 60% after 6 months of use. Another option, and that's my favorite one, is spironolactone. It's a medication that blocks androgen effects on the skin. It's often used off-label, but it can be very effective for hormonal acne. These treatments are typically considered when other therapies have failed and should be prescribed and monitored by a dermatologist. Side effects may include menstrual changes, breast tenderness, and in the case of birth control pills, a small risk of blood clots. So do not use it if you have a history of blood clots or a strong family history of that. Finally, what do dermatologists offer teenagers when nothing works or in really severe cases? Isotretinoin or Accutane is the most powerful option for severe or scarring acne. For severe acne that causes scarring, or acne that does not respond to other treatments, isotretinoin is the most effective option available. This medication works by targeting all major causes of acne. It reduces oil production, prevents clogged pores, decreases bacteria, and lowers inflammation. It is the only treatment that can lead to long-term remission or even a cure in many treatments. However, isotretinoin requires careful monitoring. It can cause some side effects such as dryness of the skin, the lips, joint discomfort, and changes in the cholesterol panel. It can cause severe birth defects. So because of that, strict pregnancy prevention measures are required. Despite these considerations, Accutane or isotretinoin can be life-changing for teens with severe acne and should not be delayed when clearly indicated. Now, what is the biggest mistake when it comes to treating acne in teenagers? And that is setting the expectation for quick results. That's not going to happen. Consistency and patience are critical for any acne treatment to work. One of the most important principles in acne treatment is consistency. Most treatments are going to take 6 to 12 weeks to show meaningful improvement. Stopping too early or switching products too frequently is a common reason for treatment failure. It is also important to use medication exactly as directed. Applying too much or using products too often can increase irritation without improving results. And then combination therapy is usually more effective than a single treatment because it addresses multiple causes of acne at the same time. This approach is supported by strong clinical evidence and is the foundation of modern acne management. Preventing acne scars should be a priority from the beginning. Acne is not just a cosmetic issue. It can lead to permanent scarring and long-term changes in skin texture and pigmentation. Early and effective treatment is the best way to prevent these complications. There is another video on the channel all about acne scarring, so be sure to check it out, guys. So teens should avoid picking or squeezing their pimples, as this can significantly increase the risk of scarring and infection. If acne is causing emotional distress, affecting self-confidence, or leaving marks on the skin, it is important to seek medical treatment sooner rather than later. Acne is highly treatable, and no teen should have to struggle with acne unnecessarily. A structured, step-by-step approach leads to the best outcomes for teen acne. The most effective acne treatment plans follow a clear progression. Start with gentle skincare and over-the-counter treatments, add retinoid early, move to combination therapy if needed, escalate to oral or hormonal treatments for more severe cases, and consider isotretinoin if appropriate. This stepwise approach, supported by dermatology guidelines, allows treatment to be tailored to the severity of acne while minimizing side effects. With the right plan, consistency, and patience, most teens can achieve clear skin and avoid long-term complications. So if you like this video, hit like and subscribe. I will try to make more videos like this, and I will see you in the next video.